Good afternoon, and thanks for joining us for today's Healthline. I'm Courtney Butts, and joining us today on Healthline is spinal surgeon Dr. Milan Mody with Willis Knighton Health and the Orthopedic Clinic. Good afternoon, and thanks for joining us.
Good afternoon. Thank you for having me.
Yeah, absolutely. So first, before we get into today's topic, tell us, you're a spinal surgeon, but tell us a little bit about what you do at Willis Knighton.
That's right. I've been in the Shreveport-Bossier area for the last 18 years, and I'm a fellowship-trained spinal surgeon, so I focus on necks, mid-backs, low backs. So we take care of patients who have scoliosis, degenerative conditions, pinched nerves, herniated discs in their neck or their back. People have had a trauma, they've fallen down, broken their back, work injuries, car accidents, so from the gamut, from the neck all the way down to the back.
Okay, yeah. So it's a very important job. You know, when we think about our back, like, it's really scary to injure that part of your body, and so it's definitely important to see a specialist like you to make sure you're getting, you know, the good quality of care and things like that. So you do surgery, but do you also do other preventative measures as well in your clinic?
Yes, I think the majority of the patients we see, we treat non-operatively. So about 95% of the patients we see, we can treat non-operatively. You know, last year we saw about 6,000 patients, and I think only about 300 had needed surgery.
Oh, that's good news.
So majority can do well without surgery.
Yeah, because as we mentioned, their back is really scary to injure, and so the thought of having back surgery can be a little, you know, make someone feel apprehensive. So that's a good statistic to know, that it's not as common maybe as people think. So today we are actually talking about tech neck and slack back. So tell me what those two things mean. Sure.
So technology is a modern marvel, and it's a necessity in our world to communicate and to do many of the things we do, but also excessive use or overuse of this technology, such as our smartphones, laptops, tablets, desktops, even our video streaming services, can lead to issues with our neck and backs. So in terms of, we talk about tech neck or text neck, that's sort of like when we're sort of looking down, you know, so the bad posture is when we're looking down in a forward flex position, and the better posture is when we're looking sort of straight ahead and keeping the phone at the eye level. You know? And it's very important that we sort of practice that, because repetitive stresses can put increased strain on our neck muscles in the back of our neck, and we can lead to fatigue, it can lead to headaches, neck pain, it can also lead to some trouble breathing, mid-back pain, and so we want to kind of avoid that or prevent that by following certain measures, you know. Keeping our head sort of flexed forward, it's already kind of at a disadvantage, because that's not how our heads are designed. Our head is about 10 pounds, like a bowling ball, on top of the neck. So if our head is sort of flexed in the right position, sort of like this, where we have a zero position here, which is kind of looking straight up and down, that's a better position, because it puts the same 10 pounds weight on our head. If we advance to looking down at 30 degrees, it puts increased weight on our head, like 40 pounds. And all the way to 60 pounds when we're looking just 60 degrees down. So to give you an example of what 60 pounds weighs, it's the weight of an average 8-year-old child, or 7 gallons of milk. So you can imagine putting that weight on top of your head, and if you do that repetitively over the day, then that can lead to very excessive strain on your neck and lead to increased problems with your neck, especially in the long run. And that's pretty alarming to know, to see, you know, the pounds like demonstrated in that way. So when you're standing, like, let's pretend that you're standing up against a wall, you kind of want your head to theoretically be touching that wall, right, to be in that perfect flexed position? Correct.
Would you say? And then anytime you creep forward, that's when you have those issues?
That's correct.
Okay, yeah, maybe, because you know, even if you just look down at your phone slightly, you know, it doesn't feel like that much, but you're putting extra stress that, you know, over time could lead to pain and possibly an injury.
That's right. Exactly.
Okay, and so what are some of those things that people are at risk for when you're constantly looking down, other than, of course, you know, pain, or what types of pain are we looking at?
So what they're at risk for, if they progressively do the same thing over and over again, we call that overuse injury, and so it can lead to pain with their neck, headaches, mid-back pain. But then over time, your discs, which are also stabilizers of your spine, can deteriorate. So the discs hold up the bones, and they're like cushions. And over time, with that forward flex position, increased stress, increased weight on those disc spaces that are not meant to be there, it can lead to deterioration and herniation of those discs. So when patients develop herniations or arthritis in their disc, it can lead to pinched nerves. It can lead to arm pain, arm weakness, arm numbness, trouble with dropping things, trouble with their handwriting, fine motor skills, so they can't do some of the hobbies that they're used to, or writing, even handwriting looks like a doctor's handwriting.
Right. Yeah, that's interesting. And so we've talked about, so the tech neck is kind of what we were just talking about. So what about slack back? So
Slack
is there
back.
a difference between the two?
There is.
Okay.
So a slack back is when we are sort of, with technology, we're sort of sitting down more, we're doing work at our computers. Many of the jobs we have, are sort of remote.
Right.
And so a lot of our staff, even in our medical clinic, are on the phones, putting down the patient's information into the computers. So when they're doing all that, it's a sedentary sort of lifestyle in a way, because you are sitting down. So the increased weight that you put down your spine when you're sitting is because of our posture.
Right.
So we can have sort of poor posture. So if you see on this side, you can see the wrong sitting position versus the proper sitting position. So the proper sitting position is where our back is upright, you got lumbar posture,
Yeah.
your screens are at your eye level, your arms are kind of relaxed onto the 90 degrees on the side, your feet are flat to the ground instead of slouching and leaning forward.
Right.
And so this is important because when you stand when you stand up, your disc spaces bear the weight of your upper body, but also your hips, your knees, and your ankles take up the weight as well.
Right.
But when you sit, what happens is all that weight of your upper body is on the discs only, not on the hips,
Okay.
knees, and ankles. Like, you're eliminating that out of the equation. So if you're standing upright, and you can see how on this side here, you can have weight, let's say it's 100%, but if you sit down, it goes up. But if you slouch, it goes up to almost double of what the normal weight is. So it increases by 90%
That you're putting on your back.
on your back, on your
Okay.
disc spaces, especially the last two
Wow.
disc spaces. And that's why if we say, look, sedentary positions or any increased sitting causes increased back pain.
Yeah.
So if you have those type of positions and you're sort of required to do that, there are definitely certain measures you should do to make sure you take frequent breaks every hour to stretch your legs, walk around for 2-3 minutes at a time before you resume that sitting position.
Gotcha. And you said it's putting the strain on the last two spaces, so that's your lower back?
That's your lower
Right.
back, right? So
Okay.
the bottom two disc spaces are the ones that we see wear out the most, because
Right.
that's what's taking the brunt of our upper body,
Interesting.
along with our hips and knees and ankles.
Wow. Yeah. So that's pretty interesting. And if nothing else, hopefully this has been very enlightening, because I know that as in the Western culture, and just I feel like with, like you said, more remote jobs, people are sitting for most of the day. And I don't know if there's any merit to this statistic, or I've heard that sometimes sitting or that sedentary lifestyle can be more dangerous than smoking. Have you heard of that before? And,
I have,
and what
yes.
is there any truth to that?
There is, because sitting can also lead to increased obesity, again, along with the back issues. And so if you develop prolonged chronic back pain, it leads to people having less active lifestyle. And so that what I recommend and advocate for my patients is a sort of variable desk.
Yeah.
Standing, we can go from sitting to standing, or a standing desk. Many of our healthcare workers have moved to a standing desk. We've done that in the hospital as well. So instead of sitting down to document things in our electronic medical record, we're standing up to doing it. Recommend doing a standing, sort of a walking pad underneath your standing desk.
Yeah.
So you get your steps in while you're documenting what you're doing, or you're working on your desktop. And again, at eye level and ergonomics, using a document holder, using things to make things less strainful or stressful to your back and your neck.
Right. Yeah, they actually have a standing desk and a walking pad, and
Okay.
it's been a great investment. You can find it on Facebook Marketplace for pretty cheap.
That's
So,
right.
okay, Georgia, thanks for joining us. And we've got our first caller, but if you are joining us and you're listening on the TV, make sure your TV's turned all the way down so that we can hear you. What's your question, Georgia?
Well, I really didn't have a question. I just had a comment. I wanted to say that I am also a victim of the long years of misuse of my neck and back. And Dr. Mody did neck surgery on me back in 2014, and I just wanted to thank him for making incredible changes in my life.
That's awesome.
Well, thank you, Georgia, for calling. How are you feeling now?
Thank you. Incredible. I mean, I don't, in 2014, I mean, we're almost 10 years, or over 10 years, and all the symptoms that I had before my surgery, the pain in the neck, the headache, they would wake me up all night long. The pain between my shoulder blades and in the neck itself, and I do not have any trouble with range of motion, which was one of my concerns. I can drive just fine, and I'm back to riding horses.
Awesome.
Good, excellent. Yeah, I think hopefully we can get to some of these patients before they get to the surgery.
Right.
So again, repetitive stresses, on their joints can cause stenosis or pressure on the spinal cord and the spinal nerves, which can lead to sort of irreparable damage. So we want to kind of, number one, teach our teens and our young people to be preventive, to use preventive measures, because that's much better than the cure.
Yeah, for sure. Well, we do have our second caller, Dennis. Thanks for joining us. And what is your question for Dr. Mody?
I would like to call and let everyone know that Dr. Mody is a great surgeon. I had major neck pain, was losing the use of my arms, and major back pain, like lightning and going down the back of my left leg and stuff. And it felt like maggots crawling under my feet. And he did surgery on my neck in 2023. And now I've got my arm strength back. I'm back in my boat fishing, which I wasn't able to do. But did my back surgery last May. I'm working in my garden, fishing. He did wonderful job. He got me out of tremendous pain.
That's
And
awesome.
I think everybody in Louisiana needs to know about this spinal doctor, because I would not let another spinal surgeon in this state touch me. That man is a gift from God, and he's an angel.
Oh, that's so sweet. Wow.
Thank you very much, Dennis. I appreciate you calling.
And a lot of times, it's so cool to hear all the compliments, because a lot of times you don't get to hear some of these, maybe,
That's right,
and
that's right,
hear how
yeah.
they're doing later on.
Yeah, no, I think that's why if you ask majority of physicians, why they do what they do, is because they want to help patients. They want to help people. But you're right. I think sometimes we hear more complaints, and that goes to any profession, right? We hear all the complaints rather than the praise. So I think when people take the time out to give you a compliment or two, I think it's godsend.
Yeah, it gives you kind of a boost as well, and
That's
so
right.
and it's rewarding too. So it
is.
makes you remember this is why you decided to do what you do.
That's right.
So we have our third caller, Stevie or Steven. Sorry, we didn't really catch your name, but thanks for joining us. And what's your question?
I want to thank Dr. Mody for. I want to thank Dr. Mody for the wonderful job that he did on my neck in 2024. And I'm doing a whole lot better, and I want to thank him.
That's awesome. Yeah, thanks, Stephen, for calling.
Thank you very much, Stephen.
Absolutely. Yeah, it's always great to hear from you guys, and it's cool. George, thanks for joining us. So what's your question today, or compliment or comment?
Yeah. This is George Killen. I've had rheumatoid arthritis and regular arthritis and psoriatic arthritis for years, and my rheumatologist just retired. And anyway, about a year ago, I had arthritis in the hip, bad pain in the hip. I don't know if that's related to this or not, but so the rest of it. And a few months later, I started having what they are calling torticollis of the neck, pretty bad pain in my neck and popping and everything when I turned my head. And then after that, I had irritation in my ribs, and he says it's probably from thoracic thoracic spine thing, and anyway, I took Enbrel for several years off and on, and then that seemed to help, and I just wonder if they could all be tied together. And they said posture had to do with my neck pain thing, and I don't know how much posture and how much other stuff, but okay, you got any thoughts on that?
Yes, sir. So rheumatoid arthritis is unfortunately a lifelong condition. So your rheumatologist has you on some of the medications to help with that. But
well, he's just retired, and I had been on Enbrel back there, but I had stopped taking it, and he was going to start me on another one, but then when he retired, I got it back in there too late. So, but anyway, I just wonder if they could be kind of connected. You know, I know the hip is probably not, but and then now let me throw this in too. I have very bad just irritation in my ribs, like my ribs are just stiff and stuck or something, and I forget what he said, something about that, but I can't remember what he said. And like I say, he's retired now, so.
Yes, sir. So I think, number one, we can certainly tie you into a new rheumatologist since he's retired. We have excellent rheumatologists in our Willis Knighton network who can take care of you and your medications. Number two, to answer your question, yeah, they are related. So your spine conditions that you're talking about, your thoracic and your neck conditions are all related to your rheumatoid arthritis, along with your hips. So rheumatoid arthritis affects all the joints, including the spine and the big joints like the knees, hips, wrist, and such forth. And there are definitely strategies along with medications that we can do in terms of physical therapy, injections to help your pain. So we'll be happy to see you anytime you want to call us and see us. You know, you call
okay.
318-212-3610.
So the ribs can be tied into that too. Like he said that probably comes from my thoracic spine, I think. And
yes.
Of course, like I say, he's gone now. But then that the ribs are so irritated. Have you heard that a lot? I mean, I've never heard anybody else say that. My ribs are really irritated, like stiffness and irritation in my ribs. I think he thought it came from the thoracic spine, but.
Yes,
Does
sir.
that make sense too?
Yes, sir. So the ribs are also joints, and they're connected to your thoracic spine or your sort of mid-back, sort of in this region, the chest region. And there's not much motion in the ribs and the thoracic spine, but there's some mild motion. So it's still a joint with some minor motion. So any joint that rheumatoid arthritis can attack, it does attack. And so yes, it is related. So rib pain can be related to that.
Okay. And one more thing, like playing golf and stuff like that, even taking out the garbage, my back gets tighter and tighter, you know, as it goes on, and does that kind of sound related too?
Yes, sir. So again,
okay.
Rheumatoid arthritis will affect most joints, including your back and your hips and knees when you're walking. So it is related to your rheumatoid arthritis. But again, we're happy to help you sort of manage the pain from that rheumatoid arthritis.
Okay, are there rheumatoid people in there with you, or you know, I know you're.
Yes, so we'll get you tied into our rheumatoid specialist at Willis Knighton.
Okay, I appreciate it.
Definitely. Thank you.
Thanks a lot.
Thank you for calling.
Bye-bye.
Yeah, thanks, George, for giving us a call.
Thank you.
And if you're just joining us, we do have those phone lines open. The number to call is 318-219-4569. It's right there on your screen if you had a question for Dr. Mody. He's a spinal surgeon. So we're talking specifically right now about tech neck and slack back, things that kind of happen with being exposed to technology. And so we've talked a lot about what these things are, but what are some strategies or those exercises that you'd recommend, or those non-operative things that you'd recommend for these conditions?
So for the neck, again, we talked about limiting the time you spend on your phones, and if you do spend time on your phone, keeping a proper posture, as we talked about, keeping it more eye level, holding your phone upright, more eye level rather than looking down. You can have phone holders or tablet holders and things, ergonomic desks to kind of bring everything up, so there's some of the strategies to kind of make it more ergonomic. The other thing we talk about is maybe just give yourself a little break, so if you have to be on your phone, you have to answer your emails, you have to take phone calls, then set a timer on your phone every 45 to 60 minutes. Take a break and do some stretching, do some neck stretches, exercises. So the simplest one is chin tuck, so imagine like taking your chin, tucking it in, and then holding it for 2-3 seconds, and then releasing, and do that repetitively for 10 times. every 45 to 60 minutes. Again, you can do some stretching, taking your left ear down to your left shoulder, and then again holding that stretch for a few seconds, and then doing the opposite.
Okay.
So there's lots of things that you can do in terms of stretching. You can bring your shoulders up, kind of like shrugging your shoulders, holding it for a few seconds, and then bringing them back down, and just letting them relax. And then of course there are breathing exercises you can do along with these stretches. We call that kind of chair yoga or chair exercises.
Yeah.
You can clearly Google that or YouTube those terms, and you'll find much better looking people than myself showing you how to do these exercises in the chair. In terms of your lower back, if you have the capability, if you have the freedom to take breaks 2-3 minutes at a time and walk around after 60 minutes at the desk, then do so, especially at home when you have that kind of freedom, because it gets the blood flow going to your legs and your buttocks. It also improves your muscle function, and then it takes that weight, as we talked about, off your upper body, off your lower 2 disc spaces, and puts them on your hips, knees, and ankles. And so that's frequent sort of breathing sort of exercise for your back. You're letting your back breathe when you take that sort of break. And then you can also do stretches as well. So you can do the stretches in the chair, where you just kind of lean all the way forward, touch your ankles, and then hold that pose for a few seconds. Breathe in, breathe out, and then bring it back up, and then do that 10 times. Kind of almost every hour. If you cannot get up and walk around.
Right. Yeah. Well, these are some great tips, some great practical tips that you can do starting today. Well, Cheryl, thanks for joining us. And what is your question for Dr. Mody?
Yes, I have some bulging discs and pinched nerve in my hip, and it's causing my toes and my inside of my right leg to be numb.
Have you seen a specialist yet, Cheryl?
They made me an appointment because I am on Medicare and I'm in Medicaid and LSU, but I haven't got up there yet, and it's going numb.
So so the numbness is what concerns me. That's why I asked about if you made a special appointment with a specialist. So having back pain, again, it's very common. It's very ubiquitous or widespread. So 80-90% of the population will have experienced neck or back pain in their life. So that can happen when you're 10 years old to 30 years old to 60 years old. So it's not the neck or back pain that really is the most concerning. It's neck or back pain that persists over 6 to 8 weeks and gets worse, or it's associated with the numbness that Cheryl's talking about, or weakness, shooting pain down the legs. Those are the things that we sort of get concerned about as a specialist. And we'll make sure that that's evaluated with x-rays, physical exam, CT scans, or MRI finding, MRI. And if it's mild pressure on the nerves, most of the time we leave that alone or treat that non-operatively with physical therapy, some injections. If it's severe, and depends on, about their deficits, they can't move their leg, or they're having weakness in their legs, or start losing muscle mass in their legs because of this severe pressure on the nerves, then sometimes you talk about doing surgery, whether we like it or not.
Yeah.
But Cheryl, again, I hope you keep your appointment, and hope they can help you out by doing the proper imaging and the treatment for that.
All right, thanks, Cheryl, for that question. And, so we're talking about neck and back pain, and that's something that you said is pretty common. And but you mentioned a couple of things of when maybe someone should worry or when they should seek out a specialist. But maybe talk a little bit more about the neck pain and the back pain, and when is it time to it's time to make an appointment with you?
Yeah. So in terms of your neck, if you start having persistent neck pain which wakes you up at nighttime, the neck pain which wakes you up at nighttime, disturbs your sleep, pain with your neck, but also associated with arm pain. So pain coming down the shoulder, or either arm or shoulder, into your hands, weakness of your hands, numbness of your hands, and things that are become sort of disabling in terms of not being able to do activities of daily living. So if you're able to have a trouble even opening a jar of food, opening a doorknob, driving because you have to shift, turning your steering wheel, those kind of weakness that we're talking about, you can't do your ADLs because of that, So you definitely should see a specialist at that point, In terms of your lower back, you start having persistent pain beyond 6 to 8 weeks that's not getting better with rest or some anti-inflammatories like Tylenol, ibuprofen, associated with shooting leg pain, leg weakness, leg numbness, or what we call foot drop. You know, your bottom of your foot just won't come up anymore, so you start dragging that foot and you start tripping. You start noticing that you trip over things like a carpet or anything, a small little curb, because you just can't bring that foot up. Those are very troubling signs, and those are the times when we really need to see a specialist.
Okay.
So we'll be happy to see you. So your primary care physician can refer you, or you can just call our clinic number, and we'll be happy to see you and evaluate you. And again, as you said, 95% of the time we can treat things non-operatively. 5% of the time they may need surgery, and we'll be happy to tell them which 5% which category they fall into.
Right, right, yes. Well, Buddy, thanks for joining us. And what is your question for Dr. Mody?
I have lower back arthritis and hip arthritis, and I think it's moved up into my neck. I'm wondering if there's some type of food that I should be eating or not eating to improve that, or some type of exercise that I can do that may improve the back pain and the hip pain without medication. And if the only thing is medication, what's the best medication, and is there anything to reverse the arthritis pain?
So let me start off tackling some of the questions you asked about food. So I think a good balanced diet is what I recommend to my patients. So again, there's no specific foods that are going to be helpful for arthritis or pain itself, but there are certain foods that have anti-inflammatory properties. So antioxidants we've heard of. So again, fruits and vegetables, have antioxidant properties. Certain spices and certain foods, have anti-inflammatory properties like turmeric. But again, I don't recommend you go out and buy supplements, up the wazoo, because they're expensive and some of them are not proven yet. But again, eating a very balanced diet, increase your fruits and vegetables, increase your protein intake. That's very important. Keeping a balanced diet will also help you have less weight on your back. Studies have shown that 10 pounds increased weight on your belly area puts a 20-pound weight on your back, just because of the way the physics are. So we carry our weight in our belly area, and the back is curved, sort of like this model right here is curved. And so when it curves like that, it puts a 2x fold weight on your back. Just like we talked about the neck, how we're leaning forward puts almost a 3 to 6 times fold weight on your neck. Same thing with your lower back. So keeping a good weight profile is important. In terms of the exercise that you talked about, I think getting you into physical therapy, letting them teach you some home exercise program to do is very important. So getting a structured program, and then go home with a home exercise program and do it, at least 2 to 3 times a week. And so what studies have shown, if people do those exercises 2 to 3 times a week, it can really help chronic pain and staying active and staying joint. All the more and more research is coming out that walking, just simple walking, is the best exercise. It's good for aerobics, it's good for your joints. So just 30 minutes a day. We don't get 30 minutes a day. But even if you just do it 5 minutes, and then 5 minutes, a few hours later do another 5 minutes, so add it up to 30 minutes a day. That alone can make a huge difference in terms of the arthritic pain. And in terms of medications, so I think the best medication I recommend is some over-the-counter anti-inflammatories. Tylenol is a very safe medication that we recommend. It's a medicine that we trust with our children, and we trust with our pregnant women. So it's is it the safest? It has no risk, no. But is it the safest we have? Yes, it's the safest we have.
Good deal. Well, great tips, Dr. Mody. We have just 1 minute left. So you mentioned if somebody is interested in getting connected with a specialist like you, they need a referral from their primary care provider, right?
No, you can just call our office, and we can see you without a referral. So,
nice. Okay, and so tell us where you're located and your phone number.
Sure. Our phone number is 318-212-3610, and we're located 7925 Uri Drive in the Portico Shopping Center, Suite 200. Right across from Willis Knighton Piermont Hospital.
Nice.
So we call it the orthopedic clinic. So myself and my partners will see all sorts of joint ailments, including the spine.
Nice. Okay. Well, this has been great. And thanks, Dr. Mody, for joining us for today. And if you missed this will be on our website. That's ktbs.com/podcast. Thanks for joining us.